We are seeing a alarming rise in the incidence of type 2 diabetes. And again, type 2 diabetes is an end result of insulin resistance in teenagers and, even younger. Kids 7, 8, 9-year-olds are being diagnosed with type 2 diabetes. And this is very scary. Because what I see on my end, again, going back to my role as a heart surgeon, when I started my career as a heart surgeon 20 years ago, I operated primarily on 60 and 70-year-olds, and I had some 50-year-olds. It was incredibly rare to see, a 40-year-old on my table was unheard of back then.
Mm-hmm.
And now I'm routinely operating on 40-year-olds, and I'm even seeing some 30-year-olds showing up on my operating table with atherosclerotic heart disease. And the reason that is because, it takes a couple of decades, right, after you become insulin resistant for the heart disease to build up enough that you're going to end up on my operating table. And so you do the math. If, someone shows up at 30, that probably means they've been insulin resistant since they were a teenager or even younger. And that's a real problem that we have to confront. And I do believe that, our youngest generation, our children, our teenagers are really where we should be focusing these efforts because they seem to be even more prone to this. The environment that they're growing up in, right? You and I had the advantage that processed food wasn't all that common, right? When we grew up, it was introduced later in our life. These kids are now getting processed food literally from birth, right? Baby formula,
Mm-hmm.
has high sugar and, vegetable and seed oils in it. It is a processed food as far as I'm concerned. And these kids are being exposed to it from birth. And that's probably a large part of why we're seeing this develop so early now.